Hi, welcome to Portage County Matters. I'm Patty Dreier, Portage County Executive. It's great to have you with us. We have a wonderful show related to public health in our schools and readiness of children for their new school year, and our National Immunization Awareness Month efforts here in our local county. So it's going to be great to talk about that during the show. But I'd like to start with two other quick notes first, and that is the State of the County speech that I delivered was on July 19th, and a copy of that speech is available at the county's website. Also available if you go to the city's website and you search out the videos and are able to watch it online in that kind of way. I hope you do. I think it's a pretty important moment every year when we're able to share the county executive perspective on where our county really stands and what's ahead of us. So thank you for doing that. Also, in late June, I submitted my recommendations on our capital improvement plan for the county. I had mentioned this in one of the previous shows. Every year, the county executive puts forth a proposal for projects of $25,000 or more to be considered over the next 5 years. I've spoken a great deal about the Portage County Healthcare Center on the show and all over the community, and I want you to know that I submitted in that project plan for consideration by the county board and the rest of the community an economic development project in the amount of $10 million to support the future of a Portage County nursing home facility to be constructed on a different location. I'll tell you more right here. First of all, you've known for a long time that we need long-term solutions for the Portage County Healthcare Center. I've spoken about it repeatedly on the radio and on Portage County Matters and in other public meetings. And we need to be able to sustain the skilled nursing mission in our county for the long run. It's not a mandated service by county government, and our tax dollars are being stretched more and more every single day, every single year, as we seek to meet our mandated requirements in balance with quality of life initiatives that our community advances, such as our county parks, which aren't mandated. So mandated requirements are things like child protective services and law enforcement, and we have chosen to have a library system, and so we want to continue to support our library, and general government and justice and corrections, and the list goes on. All stretch our county tax dollars, and so does our healthcare center at this time. I proposed in the capital improvement plan that a $10 million investment be made in building a new healthcare center on Maria Drive in partnership with the Sisters of St. Joseph of the Third Order of St. Francis. We've talked about the sisters more than once on this show as well, and in other area presentations. And this cost of $10 million would buy us a new 60 to 75 bed Portage County Healthcare Center that would be transformed into a new nonprofit center on that location, and Portage County would no longer operate it after that transition was made. This $10 million, if we stayed in our current facility, would buy us a little more than 5 years. Instead, the $10 million investment at that location, joining with $40 to $50 million of other investments from other partners and developers on that land donated from the sisters, would enable us to have the next 50 to 100 years of running in skilled nursing care to provide and ensure that services right here, local to our citizens, in the tradition of the last 100 years of service we provided on Whiting Avenue. So in 2017, no matter what, no matter if Portage County gives this $10 million investment toward that idea, toward that concept, and toward that vision, no matter if we do or we don't, the sisters will be breaking ground on a new independent living, assisted living and memory care unit on that location. We can add the skilled nursing care with this $10 million. And remember, as I said, it's about a fraction of the cost. Since it costs $300,000 per bed to construct a nursing home, a skilled nursing facility, this is a fraction of the cost of a 60 to 75 bed facility. Now, the location on Maria Drive will not only be a continuing care retirement community with hopefully this nursing home on that location, but also it will be a rural health model that we're creating and an opportunity for us to create a training place for doctors and physical therapists and nurses, and continue the tradition of standing out across the crowd. Portage County has always been unique. We have stood up for these kinds of services. We've been leaders in our state since the beginning, and it's a great opportunity for us to continue that leadership and to continue to transform healthcare in meaningful ways that serve our citizens well. So please, this is a time for input. This is a time for you to learn more. And feel free to call my office or email me and let me know how I can help you. On August 3rd, I realize that's a date that will precede this show, so there won't be an opportunity for folks to get this news and then quick go to that meeting. However, on August 3rd, these options will be laid out in a public meeting led by the Portage County Healthcare Center Committee Chair, Jerry Walters, and it will be videotaped, and you'll be able to access that meeting on videotape to continue to get yourself informed. Please help us make the wisest decision for our future. The time window right now is urgent. It would be as soon as 2018 to early 2019 that we could be looking at moving into a new state-of-the-art nursing home right here in Portage County if we can move forward aggressively to get this proposal into our plans, to borrow for those dollars in early 2017 and begin the transition. Our healthcare center staff would move with residents in a day to that new location, so residents would move with their nurses, and the nurses would provide continuous care on that new location, and then have every opportunity after we pass all the state requirements in the new location that are required when you transfer beds, for us then to make a seamless transition and have them then apply to be employed in the new nonprofit organization on Maria Drive. In the meantime, that then would free up that county tax levy and allow us to be able to dedicate that levy across all the other needs in our county and remain strong in our county government services. And that's exactly what I am striving to do through this vision and this collaboration with organizations on Maria Drive. So please, thanks for listening. Thank you in advance for looking into this on your own and weighing in with your own county board supervisors. The vote on the county's capital improvement plan will take place, I believe, in September, and it's a 1-month time window for very important processing on these ideas. Thank you. Now, I would like to turn to my guest today, Kathy Graham. Kathy's a public health nurse, but she's also our school nurse coordinator, in keeping with our healthcare theme today, for sure. Here in Portage County, we have a really unique design in how we partner with schools. Again, something that we're really great at is partnering here in Portage County. And I welcome you, Kathy, and look forward to hearing all that we can hear and share then with the people about how we ready kids for school and how we work on population health right through our schools.
Well, thank you for having me.
Yeah, school nurse coordinator. I've known you for a long time, Kathy, and it's been fun to watch you do your work, and I know that you're really a passionate nurse. Will you tell everybody more about what does it mean to be a school nurse coordinator here in Portage County?
Well, my role is school nurse coordinator, and I think sometimes people assume that I'm the supervisor or boss of the other nurses that I work with, and I'm not. My role is really to provide resources, keep the other school nurses that I work with up to date in terms of current policies and procedures. I work with school boards and promote if there's more evidence about maybe that policy should be changed or a new policy should be administered. So it's more of a coordinating position. It's an interesting position because I get to not only continue to do my work as a school nurse, but I also get to deal with administrators and other districts. So I get to really see a more broad-based perspective of school nursing because I see it in different locations and districts.
And Kathy, you're a county employee right
Yes.
there at Portage County Health and Human Services in our public health division. And in that role as a school nurse coordinator, how many other staff members join you in this mission?
Well, actually, that's an interesting question, because if I could tell you how many nurses work with me, for instance, in the Stevens Point School District, that would be 7. There's nurses that are solely assigned, say, like a school district, and with the Catholic schools, for instance, that may be a team of 3 nurses. But yet there's the body of nurses that are in the building, the other public health nurses. And so I often team with them, because if there's a situation with a child, or maybe there's a communicable disease or a situation with a family, I'm very lucky that I'm have a relationship with the people in the building, so that if I call, it's meaningful. I can get results because we have a good working relationship. And I feel that that's how we best serve the families in the districts that we provide nursing services for.
So let's talk about our public health nurses in the schools. It's not in all schools in Portage County, but in most schools in Portage County. Talk about what is their day like? What kinds of services do they provide? Basically under contract between the school district and the county. I'm familiar with that because I've participated in some of those contract negotiations.
Yeah, correct.
Yeah.
You know, it's really kind of interesting because it differs. For instance, if you're in a school that, say, has 18 hours a week, that means you can come to that building several times during the week. And so you can have different objectives. Whereas if you're in a school where you're only there for 2 hours a week, that is
As
different.
a public health nurse.
Yes,
Yep.
so that's different in terms of what can you reasonably expect to accomplish. I think the most general outcome that any school nurse has, regardless of if they're in a building for 40 hours or just for 2, is the main, I think what people depend on us for is to identify children that have health needs that could become barriers to their education. So a lot of our time is spent finding out who those children are, what do they need in order to be able to fully participate in their education, and sometimes we need help in getting them and to help removing those barriers, I should say. There's training involved sometimes with the staff, so that's probably our most primary function. And so I think some people assume that the school nurse, at least in terms of how we provide school nursing services, is a September to June 1st job, and it's not. We are working on our schools right now. We're looking at what children are coming in. We're contacting parents to make arrangements to meet with them. So it goes beyond just the first day of school and the last day of school.
Talk about immunizations and school readiness. You've got some various programs going on and outreach going on.
Yes.
In time with the National Immunization Awareness Month, per the Centers for Disease Control in the United States. Talk about that.
Well, what
Kathy.
we're lucky is to have, we have had a program in place for several years now. I don't know exactly even when it started. It's hard to remember it not existing, the recent program. And what that is, it's a registry that we can quickly look up and identify children that are non-compliant. So we can run lists, especially when the beginning of the school year starts, so we can quickly identify children who are not meeting Wisconsin immunization regulations. And so sometimes it's just merely reminding a parent, hey, your child's missing this vaccine or vaccine, and they will go in and take care of it. Other parents have difficulty with that or philosophy differences with that. And so part of our mission is to you know, not drag anybody, even though we'd like to, to have their children immunized, but just to help maybe take away some of the fears, talk about, you know, what we see overall in terms of public health and what the impact that is about denying your child those immunizations. We're seeing a trend with more and more people being reluctant to immunize their child. And unfortunately, what's happened is I think there was a feeling in the past that just my child isn't immunized, so they'll be fine, and everybody else is. And so that's not the case anymore. And I don't think parents realize that if there is an outbreak of any particular type of disease, that their child would miss a considerable amount of school. So it's, and then they would have to think about, well, how am I going to make that work if I'm a working parent? And so the likelihood, and I do worry about that because I am seeing, like I said, in terms of the amount of children that aren't immunized and what the possible repercussions that can be going forward is a little bit startling.
Concerning.
Yes.
So what are our stats here? I think they're very high.
Every year by law there is a deadline date in terms of compliance, and so the nurses work extremely hard to try to get children immunized. I mean, from written notices to phone calls. The county, we sometimes have additional clinics to help accommodate parents to get their children immunized. There's a lot in terms of the school newsletters. We meet, with parents who are bringing their children in for kindergarten to remind them, try not to wait before the first day of school. Take care of this. Tell your children these are things that you have had all along, and now it's time again. So there's different strategies that we use, but the long and the short of it is by October 20th, 21st, there's sometime during that week, the district has to be over 99% compliant.
What happens if it's not?
Then the following year, there's ramifications in terms of children being excluded from school from K through 5th grade. Last year, the Stevens Point Area School District just made it by 99.1. And every year I've seen that number get closer and closer. And I'm like, running the numbers to make sure that we're going to make it. I think some people don't understand that the ramifications is that many of our children depend on us for adult supervision. They depend on us for meals. And so if that would be in place, there would be, it's not just about getting immunizations, it's just about their health and safety, being that they're not in school. So I would dread. Other school districts, compliance rates are much higher.
In Portage County?
Yes. I mean, I think smaller districts are able to be more interactive with their parents. We're a very large district, the Stevens Point Area School District, and we accept all children from all backgrounds. And so with that comes different philosophies and acceptance of medical and health regulations. So.
Sure. We have, in Almond right now, are we in that school district
Yes.
too? I thought we were.
Yes.
Right.
Yes.
And the other school districts, Tomorrow River has a different arrangement. They
Yes.
contract with in a different scenario. Rosholt has a different scenario.
Yes, just this year they were.
Let's talk about down in the town of Grant. We have an elementary school there.
I don't think we covered.
It's through the Wisconsin Rapids School District, so it's their choice.
Correct.
And then up in, I think that covers, and you mentioned the Catholic schools and so
Right,
on.
Lutheran
so
school.
anyway, and Lutheran schools. So we've got it kind of an overlay of interactions on
Yes.
public health in those schools, and various
Yes.
districts do it a little differently based on what their school board chooses
Correct.
as a direction.
Correct.
Now, as you mentioned, Kathy Graham, I want to say your name again, and that you're a public health nurse with Health and Human Services, and you are a school nurse coordinator in Portage County, because some folks may be tuning into the radio right now or the television. But when we look at how far we've come in this model, it's as long as we can remember here.
Yeah, that's true. I just met the new superintendent from the Stevens Point School District, and he asked me, how long have we been providing services, meaning Portage County? And I said, for as long as I can remember. And I've been
It's
here
decades
20
and decades,
years,
I know it is.
and I knew that I think what has changed or evolved is the amount of time that our contract involves. That initially, even when I first started, it was very minimal, the amount of hours that we spent in the school, and years after years we've built up because of the need. So we've been there. Even if it was just basically doing vision and hearing screenings to what we provide now.
Interesting. Well, there was something I got out of the communication toolkit here for school-aged children as a target audience from the Centers for Disease Control. And I'd just like to read it out loud and then have you comment on it if you could or would. Getting vaccinated according to the recommended immunization schedule is one of the most important things a parent can do to protect their child's health. Diseases can quickly spread among groups of children who aren't vaccinated. Whether it's a baby starting at a new child care facility, a toddler heading to preschool, a student going back to elementary, middle, or high school, or even a college freshman, parents should check their child's vaccination records. And then it talks about the fact that those with, not only do we protect children, but we're protecting other people, including those, even adults, who have weakened immune systems due to cancer or other health conditions. Could you talk about that, please, Kathy?
Sure. I think one of the most common conditions that we have, especially during the springtime and even now into the summer, is pertussis, whooping cough.
Yes.
And so even though, and that is a preventable condition, there's immunization that will help prevent that. What we've been seeing, and I think is initially children would get that vaccine that would protect against pertussis entering into kindergarten. And with more and more cases, they realized that there is a need for a booster. That initial vaccine just didn't provide the longevity that they had hoped. Pertussis in itself in a school-age child, the child is ill, and I'm not making less of it, but they usually handle it well with rest and good nutrition, and they're back to school. But who could be quite dangerous for us is what you had mentioned. If they have grandparents, if they're living with a baby, it could be life-threatening in those populations. And so children very often just don't live with their nuclear family so much. They're out and about in grocery stores, shopping centers, playgrounds, and where they interact with all different kinds of children. And so the impact on our community is significant. So when we get a case of pertussis, that's where I really rely on my family back at Portage County to help, because we really jump in and try to isolate the condition so it no longer spreads to people that are unaware that they had come in contact with somebody. It can be quite serious.
So talk more about population health as it's centered out of schools in this mission that you have, Kathy.
That's a piece of it that I do sort of enjoy. We do a lot of data collection in school nursing, and so some of it is if it's even just keeping track of accidents, what is the common denominator? What are things that we can do in order to protect the overall population? Is it because they need to wear a particular type of helmet? Do we have an area where maybe we need more adult supervision? So, I'm talking about a population within the school. Health practices, just, or even reminding everybody about, just the importance during flu season, and always about hand washing and how easy it is and how effective it is. So we do some just strategies that seem very simplistic but yet are very powerful when the nurse comes in and does a demonstration or talks with children and adults about it.
And you're building relationships with those children too, just like when we have police officers in the school, so it makes it more comfortable for them in approaching them later in case they need help, or maybe they want to even be thinking about future careers in those fields by getting to know you. That can open up lots of doors.
Yes, you're right. And the other pieces, I think, is we look at physical fitness, we look at nutrition. We've worked very closely with our school food services. And it just, and the physical activity is so important to talk about kids about how important that is. And there are some children that have the mind frame that, well, I'm fine now, so I really don't have to worry about it. I'm healthy. And so I was like, no, these are things that you need to practice all the time. That it's just not just because now you're okay. That good health is something you bring well into your future. So it's just, having practices that you make part of your life always. So those are kind of the fun pieces of the job, when you're kind of just looking at the big picture. What are we seeing in terms of trends, and is there anything that we can do to interrupt that trend?
So Kathy Graham, public health nurse from our esteemed Portage County Health and Human Services. We haven't touched on the subject, but I'm aware that the role that you have in schools is really important for another reason. And that is, in the event that there may be a suspected case of child abuse or neglect. Will you talk about that and what seamlessness means when it comes to responding to a child's concerns and needs?
It's those are one of those things that are quite upsetting, but you want to be incredibly careful. We get, a lot of times we'll get calls from parents accusing other parents of neglecting their children, or the concerned neighbor who's calling in and is concerned. So we just don't knee-jerk. We want to make sure that we do a good assessment, that we talk to other people involved with the child, and we're reporters. We're obligated reporters, so that we would make a call into the county.
But you're also present in the school, and today
Yes.
can be the day you don't have to search down later to see that bruise or that,
Right.
you know,
Right.
some
Or even
some
just
other
hear
situation.
the story.
Exactly.
Or even, you know, I mean, sometimes too, there is a misunderstanding in terms of that it's neglect. It's really because they need help getting some supplies, or they need help education. So we want to make sure that we provide the help that is needed. There's only, sometimes it's frustrating. You want to fix everything and make every child be in a situation that is like the way you would have it for your own child. And so you have to be realistic about is it safe? Is it within the capabilities of the parents? Do they need additional resources, and what can we do to help them?
Well, I'm really, really proud of what's going on through your work in public health and the rest of the public health division's work. It's truly incredible, and we are continuing to be at the top of the rankings in the state of Wisconsin when it comes to public health markers, and I always keep tracking those, knowing that there's always room for improvement, knowing that every day our community changes, our families change, people come, people go, and it's really part of a tradition of caring that permeates our culture here. I want to read to you a quote from the Healthiest Wisconsin 2020 State Public Health or State Health Report and Goal, a set of goals, and get your comments on it as we start to close down the show, if I could, Kathy. Health is everybody's business, from each person making his or her own individual health choices, to champions who lead local health initiatives, to policymakers who consider health impact in every law they adopt. Together we will assure that everyone does live better and longer. To do so, the vision, goals, and objectives of Healthiest Wisconsin 2020 must permeate every sector's program and policy decisions over the next decade. So, yeah, what a charge.
What a charge, but an exciting charge, and a living charge. I think that, I think that's a perspective that I myself bring into the schools, or as a public health nurse, that is trying to model public health in terms of making good choices. To see people kind of watch you, what you do. How do you take care of yourself? Do you practice what you preach? To teaching self-reliance, and how everyone in their own way, what is it they can do to help themselves. So I think it's fun when you deal with young children and be able to teach them about even the right way to put on a Band-Aid, or the right way how to avoid a situation so it doesn't occur again. So there's so many facets to it, and that's what makes it fun. So every time you interact with somebody, you hope that they walk away with something, that they learn a little something
For the rest of their lives to apply.
I hope so.
Thank you for all the ways that you help us improve the health of our entire community through our school nursing program.
Thank you.
Portage County Matters at another great show. I hope everybody will agree, with Kathy Graham here today as my guest. If you have questions about public health, you can contact Portage County Health and Human Services. I look forward to seeing you on our next show. Thank you.